One of the most common procedures performed in medicine is taking blood pressure readings. Often it's for monitoring, prevention, or just to see how we're doing. But it's also one of the times when most mistakes are made in getting an accurate reading, giving us values that aren't ours and causing worry. I'm Dr. Ricardo Freile, a clinical cardiologist, and today we'll be showing you how to take blood pressure according to the latest guidelines. And I'll also show you how to monitor it at home to know your status before you head to your medical appointment. If you want to know this and many other interesting things, stay with me until the end of the video. So, let's go. And the first thing we're going to talk about here is that you need to know that taking blood pressure is something we should all do, at least once a year to see how we are, since high blood pressure is asymptomatic 80% of the time, and if detected early, lifestyle changes can be made, and if necessary, medication can be used to keep it controlled and avoid fatal events in the future. And the first thing we'll look at is the preparation needed to take blood pressure correctly, and we'll see this in 3 points: myself, the equipment, and the environment. First, myself. Before taking blood pressure, it's advisable not to have been arguing in a hurry or to have consumed coffee, cigarettes, or alcohol, as all these conditions will cause adrenaline to be released. And adrenaline will increase my blood pressure as a response, and if I take my pressure at that moment, it will come out high. I recommend, and I'll leave a page here, a link, which is validatebloodpressure.org. Therefore, it's recommended to be relaxed and rested for at least 5 to 30 minutes in this position like I am, sitting down. Why? Because by placing the arm at this heart level, it gives more accurate values. So if you remember this, you'll realize why we often get high values. Because we might take our pressure in a hurry before leaving the house, and that scares us, and maybe they aren't our real values. Keeping that first point in mind, let's look at the blood pressure monitor. There are many brands and models, and currently recommendations say it should be done with a digital monitor, but a validated one. And you might wonder, how do I know if the one I have is validated? It's a page in English. I'll also leave one in Spanish, where you can check and enter your device's brand and model, and it'll show if it's recommended for use. Since there are also many devices or sometimes digital watches that can claim to measure your blood pressure, but they have a high margin of error. What do I mean? That it might show 130 and your pressure might actually be 120 or 140. So I don't recommend taking it with non-validated devices. Another thing I don't recommend, although it can sometimes be reliable, is using wrist-worn devices, as they can have a margin of error between 5 to 8 millimeters of mercury, sometimes more, especially in older people, as distal arteries calcify more easily, and that will result in higher pressure readings than what I actually have. So, what do I recommend? Using a validated device, and preferably one for the upper arm. Like this, right? Now, the third point, the environment. The place where you are should be a quiet, relaxed place, where there's no noise, where people aren't coming in and out, because that will cause tension for many and will increase your blood pressure values. So when you're going to take your blood pressure, it's a quiet, relaxed moment. Let no one bother you. Sit down, wait for a few minutes, and then take your blood pressure. Now, I'm going to demonstrate the actual process of taking your blood pressure. I'll give you an example so that you know. Remember that on the monitor, it often shows the first pressure, which is the systolic pressure, the second pressure, which is the diastolic pressure, and this one here sometimes shows the heart rate, or it's elsewhere. Right, those 3 values are very important. What we're going to do once we've prepared ourselves, as we saw in the previous part, is to position it. You might ask, well, which arm should be used? I recommend taking your pressure on both arms, and whichever one gives the higher reading, you should always use that one for your subsequent measurements. The idea that it's always the left arm is a myth. Some people might have a higher reading in their right out. And just so you know, there can be a difference of 10 millimeters of mercury between arms, and that's physiological. If it's greater than that, it could indicate an underlying condition. And if anyone wants to know, let me know here in the comments section and I'll tell you which one. Right, now, since I'm already in this position, I'm going to take the monitor. Look, for the monitor, it's important that the cuff is the right size for your arm. For example, this one is standardized. It can be used here. It tells you, look, the width of the cuff, and it tells you roughly for which arm size, between 22 to 44 centimeters. As you can see, if your arm is within that range, a cuff with that diameter, with that circumference, will be suitable. If you use a cuff that's too small for your arm, it'll cause your blood pressure to skyrocket. If, on the other hand, you use a cuff that's too large, you'll get a very low pressure reading, so you need a properly sized cuff. One way to tell if it's right is that when you wrap the cuff and put it on, this part here should cover, at least leave 25% to be able to mark it, see? 75% is covered, 25% is left over. Right, with that understood, we're going to put on the cuff, close it, and the tube should always, ideally, be pointing towards the inside of the own. Here, okay? Can you see it? Because the brachial artery passes through here, and therefore the sensor will detect the pressure more accurately. Some cuffs have a little arrow that shows you which way to position the cuff so it takes the reading correctly. So once ready, we stretch out our arm, relaxed, with our back supported and feet on the floor. And on the monitor, we'll press the button to start taking the blood pressure. And we're going to start taking the blood pressure reading. Once the button is pressed, it starts to inflate. And another tip is to make sure the cuff is about 2 to 3 centimeters, or 2 fingers, above the crook of the elbow, so that if you accidentally bend your elbow, it doesn't increase the pressure on the cuff. Something else I'm doing for the video, which isn't recommended, is talking. That's another common mistake. It can raise your pressure. You might see if mine comes out high. And these little things I'm mentioning are what cause a falsely higher reading than what we actually have. Let's wait. Look, if you notice, this is the pressure reading I got. Mind you, I've already taken my pressure and it's normal, but for the sake of the video, you'll see how, for example, just the act of talking, look how much my pressure went up. That's why you have to be relaxed. Now, we're going to take a reading while relaxed and calm to see what it comes out as. Right, we're doing the second reading. Let's have faith that it'll be better. And well, here it is. Look how much it dropped now that I'm relaxing. 139/80. Even though 139 is high, what I want you to realise is that right now I'm filming a video, I'm a bit stressed about everything going well, and you can see how all that plays into getting a higher value. That's why a proper blood pressure reading, using everything we've seen, will give you increasingly accurate values. And if in doubt, taking several readings will help determine if this is your actual value. And here are some other important tips. Can I take my pressure with these semi-automatic ones where you squeeze and inflate the bulb? The answer is yes, but they're not the most recommended. If you happen to have one, you should use and inflate it with the arm that doesn't have the cuff on, as making this movement can slightly increase the pressure. That's why purely automatic ones are better. Secondly, can I use a stethoscope and take it myself with these cuff ones and inflate it? You shouldn't do that, as it can give a falsely high reading, and this should be done by a professional, as it requires proper technique and training. Now, I'm going to tell you how you can monitor it at home to take to the doctor, or if you're hypertensive, to know how you're managing your blood pressure. And what you're going to do, ideally, is start taking your blood pressure for at least 5 to 7 days, in the morning and at night. In the morning, you should take your pressure after going to the toilet, that is, after urinating. Because if the bladder's full, blood pressure rises slightly. And then you sit down, lean back and take your blood pressure. Now, at night, at least 1 to 2 hours before going to sleep. Always seated. When you get your blood pressure reading, I recommend you don't record the first one, as often the anticipation of the result creates tension and higher values. Therefore, what should be done? You're going to take a second reading and a third, and average the values, and that's your reading value. And write it down on a piece of paper, okay? You'll repeat that at night and do this for 5 to 7 days. Take all of that to the doctor and they'll work out an average of your blood pressure. You can also do it yourselves. What you need to do? Maths. Add up all the systolic values. Add up all the diastolic values and divide by the number of readings taken. For example, 14 readings in 7 days because it's day and night, and I divide that and the final value is roughly the average pressure I have. And that's what you need to understand, because that's where your pressure is moving. Remember, that pressure isn't static, it's always changing, and with that I understand much better how it is, how I'm looking after myself, and you perform proper monitoring. And that was about how to take your blood pressure correctly. Have any of these errors we mentioned happened to you? If so, let me know in the comments section to see which of them we're committing most frequently. If you want to learn other interesting things about the heart, I recommend following me on my social media as Dr. Ricardo on TikTok and Instagram. And without further ado, hoping you take care and have learned to take your blood pressure, you mustn't forget that this is what your heart needs.